Welcome to the step-by-step guide for the intra-aortic balloon pump IABP procedure. This guide will provide you with instructions for this medical technique. Before starting the procedure, gather all the necessary equipment. This includes the IABP console, IABP catheter, sterile gloves, antiseptic solution, sterile drapes, syringes, heparin, and sterile dressings. Having everything ready beforehand will ensure a smooth and efficient process. Prepare the patient for the procedure. First, apply the aseptic skin prep widely around the insertion side, start from the center and move out. Then, drape the intended area. Anesthetize the skin and subcutaneous tissues with a local anesthetic. Lubricate the distal end of the IABP catheter with sterile saline or a water-soluble lubricant. Carefully insert the IABP catheter through the arterial access site, usually the femoral artery, using a Seldinger technique. Confirm proper placement using fluoroscopy or other imaging methods. Advance the IABP catheter until the distal tip is positioned in the descending thoracic aorta, just distal to the left subclavian artery. Make a small superficial incision at the entry point of the wire that will facilitate the passage of the dilator. Insert introducer dilator into a sheath hub and then pass the sheath over the wire. Finally, remove the introducer dilator while leaving the wire within the sheath. Before insertion, fully collapse the balloon, applying vacuum with the balloon inflation device. Manually flash an inner lumen with 3 to 5 ml of flush solution. Remove balloon catheter from a T-handle by pulling straight out to avoid damaging it and insert it through the sheath over the guide wire until correct placement is achieved. Balloon should be positioned so that the tip is about 1 to 2 centimeters distal to the origin of the subclavian artery visualized on chest X-ray or fluoroscopy. Insert the catheter till the end and secure the catheter to the patient's leg with the sutures. Now remove the wire and attach the three-way stopcock, connect the tubing to the transducer and flush the lumina of the pressure tubing and balloon catheter. Please ensure the completion of all connections between the tubing and the console. Then we can press the start button, after which the system automatically purges and fills the balloon catheter. It automatically performs an individual calibration. It automatically selects the most appropriate lead and trigger, and it automatically sets inflation and deflation timing. Document the procedure, including the insertion site, catheter size, balloon timing, and any complications or interventions performed. Provide appropriate post-procedure care, including pain management, monitoring for complications, and patient education.